Hi, ladies. I'm a mom of four, and every time I've gotten pregnant and gotten sick, I was just sicker than a dog, and I felt so horrible that all I could take was Tylenol. And I know this is a serious issue for us ladies. So I've been practicing the science of mental physics for 4 years, and there's ancient wisdom, it's this Tibetan breath work, and there's this amazing technique that we do. And if you learn none of the other breaths, but you at least learn this one, it's game changer. Okay, so this is an actual technique you can do that is so powerful, and it does not take medication. Safe to do while you're pregnant. I'm not a doctor, disclaimer, okay? So I'm not giving medical advice here. I'm just saying as like mom to mom, okay? And I do like this it's a nausea inhaler because I get nauseous all the time. When I'm pregnant, I'm not pregnant either time. And so like it's a little infuser. It has this little cap, and inside of it has essential oils. And so it's Himalayan salt, peppermint, lemon, ginger with menthol. It's pretty spicy, actually. And so it helps me. I know some doctors say, like, no oils. Just because they don't do tests for women. That's crazy. But it's, like, unethical to test women when they're pregnant. But, so then they tell us, like, don't do oils. But it's, like, it can really help you a lot. And ginger, peppermint, they say that all the time. Those help a lot. Peppermint tea, ginger when you're nauseous. So that's why, like, I really like this little guy. I'm not being endorsed by them, I'm just saying, like, it really helps. But I wanted to teach you this really, really super, super easy technique. And so it's internostril breathing. So we're getting the right hemisphere, left hemisphere. It helps when I'm sick. I'm sick right now. That's why I'm like, I need to make this video and let moms know about this. Because I'm so sick. Last night I could not sleep, and I stopped breathing so many times. I have sleep apnea really bad. And even with my CPAP, like, I still stopped breathing 10 times an hour last night with the CPAP on. Like, normally it's like one. Like, it's like barely at all. But last night I was so sick. I'm just congested. I can't breathe out of my nose. Like, you can't use a CPAP when you can't breathe out of your nose. And our brain function doesn't really work very well if we're not alternating our hemispheres of our nostrils, both of them. The ancient yogis said that you need to rotate every 2 hours. And modern science says the average person, now day and age, we don't cycle for 3 hours. Is kind of the cycle for most of us alive today. So this is a really great technique, whether you're sick or you want to just feel grounded. I'm going to make some more videos of this because with like a timer and have like, oh yeah, I have this vision. Okay, but to teach you guys this, so you're going to plug one side and you're going to exhale for the count of 8. Nice and slow. And then you're going to inhale for 4. And plug both of them for 16. It may feel like a long time, but it's totally doable. Just count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And then on the other side, let it out. And then inhale. Plug. Let 16 and exhale. So the thing is when you're sick, you do not want to be super forceful with your breath, especially when you can't even breathe at all. Like nothing. Like yesterday, this side, nothing. When it was time to go to bed, nothing out of this side, 100% closed. And this side was like 99% closed. Barely could get anything, a little bit of breath in that nostril. So that's when this guy comes in handy. So for this time, so to kind of use this is you don't want to be forceful, and also don't worry about the counts when you can't breathe. It's more about switching back and taking as long as you need to just inhale as much as you can. And sometimes I take a little bit with my mouth of in and out. If I can't breathe, like, to breathe, sweeties, But okay, so like you plug one side and then inhale, hold. And then the opposite side, let go. Exhale all the air. And then inhale. Ooh, it's spicy. So sometimes, it's considered one breath to plug one side, exhale, inhale, hold, exhale. I'm pretty sure that's one breath. It's like, you know what I mean? Like there's a full cycle that happens. I think it's actually two of those. This side in and out, this side in and out, this side in and out, this one in and out. I think that's what to do considered one breath. So if you do the full one, sometimes that can I can go from like not being able to breathe at all, and then all of a sudden, like I can breathe both. Right before I did this video, like I could not breathe at all, like through my nose, totally clogged, not feeling good. I'm not pregnant right now, so I'd use like some, like a nose kind of medicine, and like it doesn't even work, you guys. Like not even like taking some of the medicines that are on the market, like, and that's a prescribed one that my doctor gave me, and it doesn't even work. Okay, this technique that I'm telling you guys, this actually works with just a little bit of a little inhaler for your nose with some essential oils. It's so much more efficient. And so there's like this little, if you like breathe in, like when you're in the hospital and you have to like breathe the thing, so then it like, you can raise up the little thing, the pressure. There's kind of a thing like that in here. If you can get enough pressure of the inward, you bring like there's a little thing inside of it that kind of raises up. So that's like knowing you're getting a really good inhale when you could feel that pressure, like the thing at the hospital when they test you. But nostril breathing, it also helps our right hemisphere and our left hemisphere when we're not blocked, when we're doing like 3-hour cycles, when we're doing these, even when we're not sick, we're doing 3-hour cycles. It's not helping our cognitive function to have reason to be able to have our words, but also like to be able to digest emotions, to be able to have logic and reason, and being able to use a scientific method, to being able to, the recall, all of this stuff, like when we're in flight or fight, our lids pop off and we don't have executive functioning. But these kind of practices like this, and I have other breaths and stuff that we do in this practice, it's amazing. It's so, so amazing. Well, I love you, ladies. We're about 10 minutes. I love you. I know it was a little long to explain this. I'm going to make some videos, though, about, to make them so they're like, maybe some shorts. So then they can be played on a loop and, just do like one round of breath and then it'd be on a loop and be able to have a timer. Because that's what I was thinking. It'd be so amazing to have this on a timer where we actually have the count of 4, at the 8 exhale, 4 inhale, hold 16, exhale for 8, See, I even messed up. And if you don't do it just perfect, it's not fun. It's not like you have to do it this way. It's about getting the practice and having super long exhales. Get all the old air out. Quick inhale. Hold it for a long time. There's something also psychological about when you hold your breath longer than you think you can, when your body starts going, oh my God, I can't breathe anymore. Oh my gosh, I can't breathe anymore. And you're like, oh, I'm at 14, 2 more seconds. I could do it. That 2 seconds of holding it just that little bit longer, those 2 extra seconds, we're training our brains to say, I know you think there's a saber-toothed tiger in your body, but like, I got you. You're okay. You're okay. We're not dying. And so then when other situations happen where you're frantic and your body already remembers like, oh, actually, we're okay. It helps like ingrain that into us. So, all right, now we're really at 11 minutes. I'm gonna let you go. Love you. Namaste. Mwah. I hope that helps all you pregnant mamas.